Welcome to the webinar. This webinar is sponsored by the CPS and OP Healthcare Project at the Maryland Institute for Emergency Medical Services System, which is funded by the Maryland Highway Safety Office. I'm Suzanne Ogaitis-Jones, and I coordinate the project. Together with Cindy Wright-Johnson, we are moderating this webinar. So here are most of our speakers for today. We also have all three staff from Maryland Kids and Safety Seats, and they will be listed as they come up in the presentation instead of on here. So the big picture. Many of you probably know that last year there was about a 15% drop in the number of miles driven in the US due to the pandemic and staying at home. But during the same time, the fatality rate rose. Actually, it rose 24%. And of course, we all know that fatalities are just the tip of the iceberg. Experts attribute the increase in fatalities to speeding and aggressive driving. It seems like people were taking advantage of the empty roads, and doing reckless things on roads often leads to motor vehicle crashes. So statistics can tell a lot, but we also want to keep in mind the human element. So Brooke Greenbaum is a big child passenger safety advocate. In 1999, her father was driving her baby daughter when he was hit by another car driven by a young person who was speeding. Brooke's father and the other driver were both killed in this crash. Her daughter, Lauren, survived in her infant car seat. You can see that's the base there. Lauren is now a driver herself, and she makes safety a priority. So we really do want to keep this human side in mind as we work on data, and I know I personally find it to be very motivating. So if you tuned into our webinar in February, you learned how data collected on the scene of a crash by law enforcement and EMS clinicians is integrated with other databases and then analyzed to identify problems, to develop and implement countermeasures, and to evaluate their effectiveness. I like this statement: what gets measured gets improved. That's from the Kentucky Transportation Center. So today's webinar is going to look at data collection, integration, and analysis, but it will focus on child passenger safety and data that doesn't start at a crash. So other data collection methods could include crash testing of restraints, engineering analysis of safety seats after they are in a crash, law enforcement ticketing, observational studies of restraint use, surveys, and focus groups, which are a type of survey. And then who are the data users? Well, this is just a very brief look, very tiny look at who might be using the data, and all of you are included in that. Okay, so the goals of the webinar. We're going to talk about several different data sources. We're going to describe some new technologies for data collection and integration. We will indicate why data is important and how it can be used. We'll share some results from some of the databases, and then we'll talk about tips for how technicians can improve their observational and recording skills in some of the systems. These are the data collection or analysis methodologies that we are covering today, and it's not a complete list of everything, and some of these are going to be just touched upon, and some of them will go into more detail because they're more relevant to what the technicians who are listening today would need to know. And then for each system, we're going to briefly cover how the data is collected, pros and cons of this data collection method, a summary of findings, and then kind of throughout the whole presentation, we're going to be thinking about or talking about how these data are used to improve child passenger safety at the national, state, or local level. Okay, so our first speaker is Doreen D. Leonardis. She is the project director for Westat, and she's going to talk about the national survey on booster seats.
Okay. Okay, I'm just going to, as I said, I'm going to talk a little bit about the national survey of the use of booster seats, and we use a short acronym for that called NSUBS, and we'll specifically be discussing today, showing you some of the data and some of the findings from the 2015 and the 2017 data collection years. We did collect data in 2019 for NSUBS, but since that data is not officially published yet, we cannot present any of the findings or the results here today. If you want to move to the next slide. Okay. First, I'd like to provide you with a little bit of background about the study. NSUBS is sponsored by the U.S. Department of Transportation, specifically the National Highway Traffic Safety Administration, or NHTSA, as most of you, I'm sure, are familiar with. Next slide. It is the only nationwide probability-based survey used that observes child restraint use in the United States. So prior to NSUBS, NHTSA and other organizations did develop estimates of child restraint use. However, most of those estimates were based on data from non-probability samples that may not have resulted in national estimates, or telephone interviews, which, as a lot of us may realize, do not provide the most reliable estimates. As we all know, people are always very honest when you ask them if they have ever driven over the speed limit or if they actually wear their own seatbelts when they're driving. So you can see how their honesty may translate when you ask them if they're traveling with their child that is restrained. So NHTSA issued a request for a study that would develop national estimates of child restraint use. Westat has designed and conducted that study for NHTSA since 2006. We've conducted it annually between 2006 and 2009, and every other year since 2011. And then NHTSA uses this data to evaluate their programs and target their outreach and education programs at a national and regional level.
Yeah.
Okay. So how do you create a study that generates national estimates of restraint use? You need to first observe large numbers of children traveling in vehicles. And part of our design was to select locations that were frequented by children. So before March 2020, you could find large numbers of children traveling to daycares, rec centers, fast food restaurants, and gas stations. And these were the kinds of businesses we visited during NSUBS data collection. In 2017, we visited over 600 sites or locations, businesses. We observed over 7,000 vehicles and observed over 11,000 children in those vehicles. We would work in the parking lots of these businesses, and we would ask our data collectors to observe restraint use of all occupants in vehicles that were traveling with children in them. They observed the restraint use. They also, once the vehicle stopped, they would approach the driver and ask them if they wanted to participate in a small interview. They would ask them the age, height, and weight of all the children in the vehicle, and then the race and ethnicity of all of the vehicle occupants. So next slide. So now that I've given you a little bit of background about the study, I just want to provide you with some of the information and show you some of the data and the estimates that can come from our efforts. Okay. So because we collect the age of every child in the vehicle, we can calculate the national estimates of restraint use for the children by age group. So this figure shows you, it compares the 2015 and the 2017 estimates for children from the ages of 0 to 12. The green bars, or the green columns, are the 2015 data, and the gray columns are the 2017 data. So I'm going to direct your attention to the far right, which basically gives you the overall estimate for all children between the ages of 0 and 12 years old. Okay, what you'll see here is circled in red is 2017, there were about 90% of the children we observed were restrained. That means they were restrained in any type of restraint. That's not the correct or the proper restraint. That just means they were restrained in a type of restraint when they were traveling in the vehicle. That's up slightly from 2015, which was about 89%, but there was no significant difference between the 2 years. So now if you kind of look at the rest of the chart, the graph that I'm showing you, you'll see that we broke age down by age, by 0 to 12 months, 1 to 3 years, 4 to 7 years, and 8 to 12 years. And if you kind of take a broad look at all of those columns, what it tells you is it basically confirms what we all know based on our experience, that restraint use in children declines as children age. So the 0 to 12 months old are up in the high 90s. They're 97.9% in 2017. But then as you go to the right of the chart and you see the ages 4 to 7, you'll see restraint use drops to 89% in 2017. And then for the 8 to 12-year-olds, you'll see it drops even further down to 86.5% in 2017. Okay, next slide. We can also generate estimates of restraint use by gender and age group. So again, we observe the gender of each of the children. So if you look here, it's broken out by boys versus girls. Boys in this case are the green columns and girls are the gray columns. And if you look overall at this slide, you'll see that there is no real difference between restraint use for boys versus girls, except for the age group of 0 to 12 months. In that age group, even though it looks like it's only a slight difference, 98.7 versus 97.2, that is a significant difference where boys are restrained at a slightly higher rate than girls are for that particular age group in 2017. Next slide. Okay. This slide is pretty busy. So because we ask the driver to identify the race and ethnicity of all the vehicle occupants, we can generate estimates by race and ethnicity. So you'll see here again, we've broken everything down by age group and by race and ethnicity. Okay. The important thing, the thing that I see when I look at this chart is that age category between 4 to 7. Overall, across all ages, the highest restraint use based on the NSUBS estimates is observed for non-Hispanic Asian children between the ages of 4 to 7. That's 99.8%. That's the closest to 100 we have out of all the age groups and all the ethnicity breakdown. The lowest restraint use is non-Hispanic Black children between the ages of 4 and 7 at 75.8%. Just with those two groups alone, there's a 25% difference in restraint usage. Okay, next slide, please. Collecting the data on the age, height, and weight of the children allows us to determine if the children are traveling in the appropriate restraint for their age and their size. So again, NHTSA recommends that all children under the age of 1 travel in a rear-facing car seat. So what you'll see from this data is 92% of the infants that were observed were in rear-facing seats in 2017. However, if you look towards the right of that slide, what you'll notice is 5.2% are in forward-facing seats, which is not appropriate based on the NHTSA recommendations, and 2.1 are traveling completely unrestrained. Next slide. NHTSA also does a similar analysis for children between 1 through 3 years old. Again, for this age category, one would expect that the children would be traveling either in a rear-facing seat or a forward-facing seat. And you'll see about 84% of the children are estimated to be traveling in a forward or a rear-facing seat. However, as you move to the right of the slide, you'll see that a large number of them are still traveling in restraints that are not appropriate for their age or their size. So we have 7.6% in 2017 were transitioned to booster seats, 2.6 were in seatbelts, and 4.7 are traveling completely unrestrained. Next slide. I also wanted to present the 4 to 7-year-olds to you. So similarly with the 4 to 7-year-olds, about 68% are traveling in a forward-facing car seat or a booster seat, what you might expect for children in this group to be traveling in. But then as you look to the right of the slide, you'll see, again, we have an increase. Almost 21% of the children are traveling in seatbelts, and almost 11% are traveling unrestrained. So if you think about the last few slides that I've shown you where we've broken out by age, you'll see that as the children age, a greater percentage of them are prematurely transitioned to a restraint that's not appropriate for them, or they're traveling unrestrained. Okay, next slide. So because of the type of study we're doing, the sampling design, the number of sites we visit, the data that we collect, and the amount of data that we collect, NSUBS can provide some national estimates as well as regional estimates of restraint use by gender, age, weight, height, and race ethnicity. We can also, as I said, give you estimates based on the region of the country. We can determine the percentage of children that are prematurely transitioned from one restraint type to another restraint type. We can also provide estimates of restraint use for children by the age of the driver. So is a child more likely to be restrained when they're traveling with a younger driver versus an older, or vice versa? Is a child more likely to be restrained when they're traveling with a female driver versus a male driver? Or are they more likely to be restrained if the driver themselves is restrained? Those are the kinds of things that we can use this data to sort of dig through and tease out. What we cannot determine based on how our study is designed, because we do not allow or permit our data collectors to touch the child restraint seat or touch the child. We cannot determine if the CRS is installed correctly, how it is installed, whether it's installed with a seatbelt, latch, or both, if the child is properly secured in the CRS, or if the CRS is recalled or expired, or who may have installed that CRS for the caregiver. So I'll be interested to hear some of the other data sources that we're going to be talking about today, because I believe in those cases we might be able to get this information, which would be very helpful. So, and
Thank
that's
you,
it for
Tori.
now.
Thank you very much. So we will move on. If I could change the slide. It's inconsistently changing. And our next speaker is Mark Wall, who's the Occupant Protection Program Manager with the Maryland Highway Safety Office. And Mark, I'm going to turn that over to you now.
Thanks a lot, Suzanne. Well, as Suzanne mentioned, my name is Mark Wall. I'm the Occupant Protection and Distracted Driving Program Manager at the Maryland Highway Safety Office. Feel free to contact our office or myself if you have any traffic safety needs. Next slide, Suzanne. Today, I'm going to briefly go over the Maryland Seatbelt Survey. So the National Highway Traffic Safety Administration publishes uniform criteria for states across the country to conduct observational surveys of seatbelt use. So here in Maryland, the National Study Center for Trauma and EMS at the University of Maryland conducts a comprehensive study of seatbelt usage in the state of Maryland for the Maryland Highway Safety Office. Seatbelt usage data is collected on drivers and front seat outboard passengers. In 2020, we observed a total of 42,031 vehicles at 130 selected sites. Observed vehicles included passenger cars, vans, sports utility vehicles, and pickup trucks. Basically, any vehicle under 10,000 pounds. All data is collected on occupants and vehicles traveling on primary, secondary, or local roads. So taking a look at the maps you see here, Maryland's comprised of 24 jurisdictions, including 23 counties in Baltimore City. Well, for our observational study, NHTSA just uses the ones you see here in pink. Those are 13 jurisdictions in pink, and we selected 10 roadways in each of those, and then we count those passengers in that car. There have been years past where we've done backseat surveys, but every year on an annual year, we do the front seat survey. You can go to the next slide. And click it one more time. We basically covered this information. We sampled 13 of Maryland's 24 jurisdictions, and we selected those 13 because that accounts for 86% of crash fatalities in Maryland, according to FARS data. And anyone not familiar, FARS is the Fatality Analysis Reporting System. And we had 10 roadways in each of those 13 jurisdictions. You can go to the next slide. So the sampling design, the final results were weighted by probability of the road selection by VMT, which is vehicle miles traveled. Results for known belt use provided for all occupants combined, by jurisdiction, by vehicle type. We also did it by roadway type, which was the primary, secondary, or the local roads. You can go to the next slide. So if you take a look here, this is another map. This was how our results came in. If you see some of the counties or jurisdictions in red, they were below 85%. The orange, 85 to 89%. Yellow, 90 to 92. And the green was actually 93% or higher. So basically, data is collected on sites where traffic is moving during the observation period at a controlled intersection, ramp, overpass, or side of the road. Site assignment sheets with maps and other information about the location are provided to observers for each jurisdiction, and we do have state quality control monitors that are available for assistance throughout the whole process. You can go to the next slide, Suzanne. So when those factors came in, if our 2020 results are in, and as you can see combined, Maryland is at 89.9%. That's actually below the standard here in Maryland. We actually like to keep that seatbelt rate above 90. And we were at 90.9 for passenger cars and SUVs. Definitely lower with the larger trucks, pickup trucks at the 85%. I will say I was on a call with NHTSA the other day, and last year in 2020, due to the COVID crisis that we had across the country, only 21 states conducted a seatbelt survey last year. So Maryland was one of those states that actually, fought through the pandemic and all the challenges and actually accomplished that seatbelt survey. I think we have one more slide in there, Suzanne. We also have the breakdown of the seatbelt use on the roadway type. So as you can see, the combined would be the same, which is our overall rate. But on primary roads, your beltways, your 95s, the 695s, the rate is higher up. You've seen it get a better seatbelt use on those faster moving roads. And then you have the secondary roads at 89.6 and the local roads at 80.6. So we do have work to do. We actually continue to keep pushing the message to wear seatbelts. The data shows that when the front seat passengers are buckled, the back seat passengers are buckled as well. So thank you for joining us for this short presentation. If you have any more questions or concerns about the seatbelt survey or data collection, feel free to contact me on my contact information there.
Thank you, Mark. So we just heard about two different survey system data collection systems that were both observation-based methodology. Now we're going to switch to something that is a little different. And I'm going to explain the behavioral risk factor surveillance system, but I have to note I am not an expert in this. I'm just giving you a quick overview so that you will know about it and can use it if need be. So this system was established in 1984 with 15 states, and it has a fixed core of standard questions that are asked by all the states and includes a lot of different types of questions, like lots of different behavioral issues. So seatbelt use is just one of the questions. The Maryland version is fielded to approximately 15,000 individuals across the state, and it's conducted through a telephone survey using both landlines and cell phones. There's also a youth version of this survey, and the questions are asked in middle and high schools. And it's the same seatbelt question, which is here. Pretty straightforward. How often do you use seatbelts when you drive or ride in a car? So you can go online and you can sort this data by different demographics, as you see here. And I did a quick little sort and sorted by folks answering always wear a seatbelt. This is the adult survey, and sorted by counties. So anybody remember Mark's map of the observational surveys of seatbelts? How much does this look the same as what was actually seen through observations? Do you remember? It's a quiz. So I inserted Mark's map back again. So your takeaway from this should be that not everybody's telling the truth in the self-report surveys. Okay, so that's just very quick on that data collection method. I want to talk about another method, and this is going to be a very brief overview, and that would be, oh, I did want to mention one thing before I go on to this. Let me backtrack just for a moment because I did want to say it. So the limitations of the behavioral risk factor surveillance survey, it is self-report. It takes about 27 minutes to complete this whole survey on the telephone for the adult version, which not everybody's going to deal with staying on the phone and answering questions. So the youth part of it, when I looked at the middle school students, 94.5% said they sometimes, mostly, or always wear a seatbelt in the car. Again, I don't know how truthful they are being there. but this is why we would compare it to other results. Okay, sorry, now let me go back to Safe Kids. So Safe Kids program should be familiar to a lot of the technicians, the car seat technicians listening in on this webinar, because if you've ever participated in a seat check sponsored by a Safe Kids coalition, this is the form you have used. And these forms are filled out for how the seat comes in on arrival, and then you make the notes for what you have done, you and the parents have done to change it. The coalition coordinator collects these completed forms and sends them into Safe Kids Worldwide, where they are electronically scanned and tallied to get the summary data. In 20 years, they've collected more than 2 million inspection forms. The coalition coordinators can access their data, and then Safe Kids Worldwide uses all the data to prepare summary reports, and they use it to support new initiatives, to create educational materials, social media, and to support legislation. For example, if looking at some of the data from 2016, they said that caregivers on first coming into a seat check, where they had a forward-facing seat, 64% of those caregivers had not used a top tether on their car seat upon arrival. So that definitely produced a lot of initiatives to increase tether use. They also have done some follow-up surveys with smaller samples of the parents at their seat checks, where they're asking them some questions about what they know before they come in and after they leave. And they found significant gains in knowledge on a number of measures, and reported that caregivers' self-confidence in their ability to use their car seat tripled by the end of the seat check. Okay, so these are just some of the materials that you can get from their website. You don't have to be a Safe Kids member to access any of this. And the picture on the right is their tether report. Okay, so now we're going to switch to the Raven project, where Sean Lynn and Glenn Sine are going to discuss their program.
Thank you. Good afternoon. On the call with me today is Glenn Sine, who is the GIS Senior Project Manager for a grant that we work with in collaboration with Maryland Highway Safety Office. So I wanted to kind of touch on, what the application is, and some of the information that we've seen today is actually available inside the application. So I'll talk about that later in the presentation. So if you haven't heard of the application is a risk analysis of vehicle environmental network, Raven. And what this application is a way to display visually crash and electronic citation data throughout the jurisdictions in Maryland. So each of the jurisdictions, we have 24, which includes Baltimore City, are processed and run through each year. Currently, inside the application, we have data sets going back to 2013 to current. What I mean current, I do apologize, is the 2019 complete data set. As we go through a closeout year, just like 2020, that data is currently being processed, and that process does take some time. So we'll be having that information inside the application later in the late summertime, early fall, as it takes a good bit of time to make sure that all our T's are crossed and our I's are dotted. So why is a great question about the application. It is a way to take a look at historical data and providing it in a format that can be seen using a way of translating that information from taking a look at each of these individual crashes and coming up with the story to tell on our roadways. So this application has been in existence for the past 5 years, and a majority of it has been in collaboration with the HVE campaigns, the high visibility enforcement campaigns. Early in the start of this meeting today, there was a slide that showed where this data was coming from. This data here is a data set that is coming from Acres, which is being collected by Maryland State Police and being processed through State Highway Administration, or SHA. So this is a data set that we work with SHA on, and process this through utilizing GIS to come up with these data visualization formats. And our target audience when we are doing this application is law enforcement and traffic safety professionals and injury prevention professionals, which include all of you that are joining in today. So next slide, please. Talking about the actual application itself, and you see a small sample on the bottom right corner. The main focus of the application is being able to see data visualizations of various types of crash data, citation data, and other data sets that are available on the open portals, which include, as you see, some of their schools. We have liquor license locations. So some of those data visualization formats include hotspots, road segments, and tessellation bins, focused in on overall crashes or emphasis areas. What I mean by emphasis areas are target areas for the state, which include aggressive driving, speeding, distracted driving, occupant protection, those types of groups. And then, as I was just mentioning before, we have the seatbelt observation locations, the stuff that Mark was just showing with the stats and the figures of those seatbelt observations are accessible through the Raven application, and you can turn on those layers and click those points to see where each of those jurisdictions that we are collecting that information for, what their actual numbers were each year. The 2021 just became available, and that one will be processed, but we have the previous years inside the application. And then additionally, we have additional resources. We have products that are consistent and used on a regular basis, such as our holiday maps that are driven through law enforcement efforts that are being conducted through HVE campaigns and each of those jurisdictional campaigns as well. So with that being said, some of the additional stuff that we do have in the application is we have child passenger technician locations. So if there are additional things for those who are new to the application or those who have access to it already, if there are additional things that you would like to see inside the application, please let us know. We have the capability of integrating some of that data so you can overlay it. And the last thing I just want to mention here on this slide is that our hope is for the application, for those who are using it, is to be able to quickly ingest information. And what I mean by that is the application is designed for you to quickly turn on and off layers that are pre-run. Our analysts at the Office of Washington College GIS program have already processed, analyzed, and reviewed the data that you will see inside the application, quickly turn on and off, and be able to quickly take that information out via screenshot. I know a lot of people use screenshot. We have an export of PDFs or PNG. And then the last thing here is if you're not a registered user of Raven, I put a QR code so you can snap it on your phone if you're working off of a laptop and you have your cell phone handy. But I also included that link, which is the registration form. If you go ahead and complete the form and email Glenn Sign, gsign2@washcall.edu, we'll be able to work with Maryland Highway Safety Office to get you approved to access. Please feel free to follow up with Glenn with any additional questions. We'll work with you. Again, my name is Sean Lynn, and we look forward to hearing from you. Thank you.
Great, thank you. And just a note for all the speakers, on one of the handouts will list the ways you could contact them or their data collection method that they covered. So our next speaker is going to be Tracy Whitman, and she's the program coordinator for Maryland Kids and Safety Seats, and she will talk about their data collection.
All right, good afternoon, everybody. So I'm here to talk about or start the conversation about car seat inspection forms and the data that we can collect with them. A car seat inspection event, for those who don't know about it, is an opportunity for a caregiver who has to transport a child to come in and meet with a certified child passenger safety technician and go through a methodical evaluation of if the seat's the right seat for the child, if it's installed correctly, and if it's being used correctly. There'll also be additional education on top of that. So what you're looking at on the screen is Maryland's longtime hard copy car seat inspection form. It was traditionally a two-sided checklist set up in a rear-facing, forward-facing booster section, and it was an 8.5 by 14 size, so it was quite a large form. In the samples on the screen, you will see on the left side what a completed uninstalled, meaning the car seat arrived completely out of the vehicle or not out of the box, it was not attached to the car in any way, a car seat check form and what it would look like, versus on your right screen, you'll notice a completed car seat inspection form. When the seat arrives installed, we would also capture if the child was present and check for misuse and if it was and how it was installed using those prompts. Whether it was pre-installed or not, there is a seat left section on the bottom of the form, and we would check off all of that would apply. A bonus to the form is when the child was transitioned into the next type of restraint, we did have visual prompts on the seat left side of the page in a checklist format to remind our technician exactly what needs to be done to graduate that child into that next transition. It may have been a rear-facing to rear-facing convertible, or it could have been a rear-facing convertible to a forward-facing, or it could have been a forward-facing to a booster. It was designed to help the technician be methodical in helping that caregiver make those adjustments to the car seat. In our field, many of the inspections that we do perform are on rear-facing only seats, so we felt it was really important to give technicians those prompts to help them remember what needed to be changed as they went through the education session. The con to the form is that it was subject to human error. We are technicians, we can all interpret something different. So what you'll see is that the boxes were often checked off and then crossed off towards the bottom of both of those forms. We had situations where we'd have prompts that were missed. There could be something filled out in the checkbox, but it would not match the narrative, because as we would do our evaluation summary, we would go through those narratives one by one on each form. And if the checkboxes didn't match the narrative, we had to circle back with the technician or the senior checker to be able to accurately complete that tally sheet. Next. Additionally, it was only one form per child. So if you were dealing with multiple children in a vehicle, we'd have multiple forms on the clipboard, and that's usually where there was how the seat left mistakes would happen, because they'd start filling out the wrong information for the wrong child. And then we'd start crossing and arrowing. It got to be a little messy on the forms. Next slide, please. The forms for each event were separated into rear-facing, forward-facing, and booster seat forms. And then we would go down a checklist and just group the number of no's that were checked off into a 1, 2, or 3+ error tally sheet. Very scientific, literally going through with tick marks. That information was then written into a summary that took the total number of seats seen at the event. We would subtract out the new installations because they would not be included towards the misuse rate. Subtracted out the correct number of car seats, so those that arrived correct and left correct. And then we take that final number and calculate the misuse rate for those inspected seats. What it could tell us was how many seat totals and for each car seat stage. So we could check the number of rear-facing convertibles, forward-facing boosters. It could tell us the number of new installations versus seats that arrived installed to the car seat event. And for the installed seats, it gave us instances of misuse that were grouped by 1, 2, 3+ errors, or we actually also had a category of gross misuse, which is severe injury, life-threatening misuse. The forms were really limited with the paper form. The data that we could use was pretty limited. Unfortunately, due to staff power, as many of you know, data takes a lot of time and effort and a lot of staff and a very intense process. We just did not have the staff power to record things such as how the seat arrived installed versus how it left, overall, how many lower anchors versus seat belts were being used, were they being used together, how compatible was the seat with the vehicle, or if the vehicle was moved to a different position. We've known for years that we needed a better way to capture what was happening in the field, but we didn't have the staff or capacity with our agency to go through each individual checkup form to record the many, many variables by going through each check to find the prompts, to find out harness errors, installation errors, seat selection errors, recalled seats, and so on and so on. But this form is also subject to human error, such as how they read or interpreted the prompt on the form, or if they missed checking something off and a senior checker also missed it, even if a senior checker was present. So even the tally sheet could have errors in what was sometimes tallied up. We also had situations where car seat technicians would use the forms on an individual basis, either as a straight volunteer or perhaps back at a local agency, and they don't send those forms to us. So we know that we have missing forms, thus missing data across the state. And then calculating the annual average of misuse rates were just based on the summary seat check forms. All we would do is add up the entire misuse, all of the misuse for the year, and then divide it by the number of forms that were actually collected, and that would give us a general misuse rate. We did move to the National Digital Check Form, and that is actually a digital car seat inspection form. We were very fortunate, we were early adopters, and between July 1st of 18 and September 31st of 2020, Maryland had entered almost 1,200 forms into the site. They are a combo of KISS supported or sponsored events and individuals, technicians using that for their personal inspections. And we know that because now we can see all of the individuals' responses when we pull a query on the statewide National Digital Check Form data. There are advantages to using it. With it, we can determine the distance traveled from where people live versus where the checkup event is being held. That does help us with programming. How many people learned about, or how people learned about the services, which can assist us with program outreach. The National Digital Check Form collects more data fields in a very consistent and methodical manner. It does now download into an Excel spreadsheet automatically when we query and pull the data down. And it will allow us to look for misuse trends among particular car seats or vehicles. And the nice thing about the digital form is if prompts are missed, it will be caught when you're trying to submit the form into the system, because it kind of goes through a data system check. So now the data is much more complete. There is a con to using this, and that is that we are still using a tally sheet to run misuse, and just going through that seat check form, using that same seat check form we used with the hard copy. We now have so many data fields that it's just too much for us as KISS with 3 staff to be able to handle. So we were, up until very recently, only pulling the general misuse rates to complete a summary form using the tally sheet, and we really were not diving into what we can now see with the data. Unfortunately, we're not epidemiologists, and so we've been kind of stuck with how to calculate and use that misuse information. So we have not been using that digital check form data to its true potential. Now, the National Digital Check Form Workgroup did recently release a data dashboard, and I've just started diving into that now. I'm really excited to see how that's going to be able to help enrich our data collection and evaluating what we see. We entered COVID times in this phase, kind of where we were using the National Digital Check Form, doing a hard copy tally, kind of stuck with just still looking at general misuse rates. Until we moved into our video call seats using the National Digital Check Form. When COVID came about, we moved from in-person programming to virtual programming, and we are offering video car seat assistance. And we are now using the National Digital Check Form to record those calls. And I'm going to now mute myself so Liz can take over and explain that in the next slide.
Hey everyone, my name is Liz Kidwell. I'm the health educator for the Maryland Kids in Safety Seats program. So I'm just going to talk for a quick minute or so about the video appointments that we've been doing and our current data collection process, I guess, so to speak. So as Tracy mentioned, because of COVID conditions, we did move pretty much our entire all of our education to an online kind of virtual platform. So we started doing one-on-one video calls with caregivers to provide education and teach them how to use and install their car seats via Zoom. And we've pretty much perfected that system as of now, but we have changed up the way that we collect data through that. So initially, we were just using a basic spreadsheet. We were putting appointments on the spreadsheet, and then we were just tracking the number of appointments, number of car seats, and types of car seats, and writing notes about what we did and what we talked about in the call. So this spreadsheet did allow us to see some basic information, but we started thinking about what we might be able to see if we used a different process. So in February of this year, we decided to try out using the National Digital Check form with our appointments, and we have been using that ever since. It has been, we've had a few challenges with it. It's been a little bit different than our original process, but we're still kind of exploring the pros and cons of using this form and what it may allow us to see in the data on our virtual calls. So it does allow us to see potentially some more detailed data because it has more questions. We have to go through more prompts as we go through that form. And then that can kind of come out into a data dashboard or a Excel sheet, and we can kind of go through that information there. As Tracy mentioned, we're not epidemiologists, so we don't really have a lot of ability to really tailor through that data. So we're really trying to figure out what we might be able to see with that. But we are also keeping in mind that this is really anecdotal data that we're using right now because our video appointments are we're looking at them more as an educational service. It's not a full seat check. We're not there in person. There are plenty of times where we aren't really able to see what's going on in that person's car because it's dark, or the video cuts out, or we have one caregiver and they've got shaky hands, or they've got somebody else holding the camera, and you're seeing all around inside the car instead of what you actually need to see. So it depends on the call. Sometimes you can see very clearly what's going on, and sometimes not so much. So we're not necessarily utilizing this data to call it a misuse rate or anything like that. But we are definitely interested to see what type of information we can find with this. So we're definitely still exploring that. We're really hoping it will give us more of a systematic compilation of information versus just a summary or description of what we're looking at. The form may better kind of demonstrate the differences in what data is collected and its accuracy, rather than having us read through, paragraph after paragraph of our notes, because we do tend to make some detailed notes, which is great, but it's hard to kind of read through. We've done a lot of video appointments at this point. So hopefully that national form will help us kind of limit the amount of human error that could come in through that, and just have kind of a systematic process. But ultimately, we're hoping that this data will help us better kind of tailor our educational messages, because we can look at maybe most common errors that people are making. It will also hopefully allow us to see the different areas in which people are using our services. We're not sure that if, while we're offering video calls, we're not sure if maybe we're reaching higher risk or hard to reach populations with this, people that maybe couldn't come to an in-person seat check. So that's something that we can hopefully find by using this national digital check form throughout the state. And then we're also going to hopefully start using this form in our national events that we've been conducting with the DMV Regional CPS Network. So we're holding those quarterly, and we're going to hopefully start using this form throughout those events as well. So hopefully that can kind of show us some data state to state in how that looks a little bit different towards just Maryland. So that's my spiel on video appointments. I'm gonna mute myself because Claire's gonna talk a little bit more about some other data collection strategies that we've used in the past and kind of what worked and what maybe it wasn't so great.
Thanks, Liz. So if we take a step back from forms, we do know, like Liz said, that we're only touching on a small subset of the population who travel with children, and it's probably very motivated caregivers who do participate in seat checks. Another option is to take what we believe is happening or not happening, or think about what we've observed in our daily life as we're driving around, and figure out a way to gather information based on these feelings or observations. So an example is that KISS may need to look at where to recruit car seat assistance programs where people can get a low-cost car seat, or where we should hold more seat checks, where we should provide educational outreach, or gather information for grant writing. So real-world crash injury data and a push toward expanded booster seat legislation prompted Maryland to upgrade our law in 2002, and the law went into effect in October 2003. To look at how the legislation was going to change child restraint use, we coordinated a statewide Maryland Child Restraint Use Survey, which was much lower key than what Doreen described. But we used volunteers from Safe Kid coalitions, techs, health department personnel, a lot of people with uniforms and badges, and other child safety advocates. And we observed in specific sites throughout the state. We collected data 2 months before the law went into effect, 6 months later, a year later, and then we also wanted to know whether the law actually made a difference. So all of those observations, we collected about 1,000. We saw about 1,000 children. So it was a lot of work for not a big outcome. And then a few years later, we spearheaded a 4th observational survey looking at how children were riding in cars. We had to get verbal permission from the caregivers, and we had to collect the child age information by asking those questions at similar sites. Again, we were using volunteers, the sites had to agree to participate. So we had much lower response rates. But despite the challenges of conducting observational surveys and of car seats and seat belts, there are benefits to getting this naturalistic data from schools, daycare centers, or other areas where people might report that they see a lot of unrestrained or incorrectly restrained children. It will provide us a snapshot of the public awareness and effectiveness of our current law. It will provide a snapshot of regions in Maryland where booster seat education or restraint education in general and enforcement should be increased. And it's going to provide statistical support and justification for any enhancement of Maryland's current child passenger safety law. So it has a place, and it really is a good idea. It's just a lot of work when you're trying to use volunteers. So it was a good learning experience.
All right, well, good afternoon, everyone. I am Adele Poulson, and I lead Westat's efforts to support the National Digital Car Seat Check Form, or the NDCF, as we call it for short. Westat is responsible for the data cleaning, data analysis, and visualization. Before I jump into the data, I'm going to give everyone a quick overview of the program, and then I'll explain the data processing and results. And I really appreciate Tracy touching on some of the pros and cons and being able to speak to what it's like to use the NDCF, and hopefully I can fill in some more of those details. So this source provides one national standardized data collection tool that is available for free to all certified U.S. child passenger safety technicians and instructors. This program was funded and supported by NHTSA, the National Safety Council, and AAA. CPS programs conduct car seat checks through a variety of settings, and the NDCF allows that car seat check data to be collected, stored, and accessed by technicians as well as by program managers. Seat check data can be used to monitor trends, seat distributions, issues encountered in the field, which will ultimately enhance and change the way we provide outreach and education to families. The data can also provide important information to support grant applications and position and program justifications. Additionally, car seat and automakers have an opportunity to review the data and determine engineering and design improvements. The NDCF was developed with input from CPS technicians from different geographic areas and program styles. As a result, the NDCF is available in 5 different platforms to support a variety of program needs. First is the web-based platform that can be used on a computer, tablet, or phone by logging into carseatcheckform.org. And you will notice that a web address at the bottom of most of my slides. So if you forget it, just look at the bottom of the slide, carseatcheckform.org. Second, there are 3 mobile apps available for Apple, Android, and Amazon. These apps provide the ability to conduct car seat checks and collect information electronically in areas where internet access or connection to the Wi-Fi is limited, where you wouldn't be able to use the web platform. You can download these apps for free by visiting the App Store and searching for Car Seat Check Form, and then look for our little green and white logo there. And last but not least, we do have a corresponding paper check form that is also available to use when either a device isn't available or you're just more comfortable with the paper form. I want to be clear that we do not collect personal identifying information. All of the data from the NDCF is stored on a secure server. Considering the professional obligation with respect to privacy rights of caregivers, personally identifiable information, or PII, is not collected through the NDCF. For agencies that do require that, the NDCF does generate a unique identifying number for each car seat check that can be linked to a paper form that different agencies can use to collect the PII from their caregivers. Constant improvement and evolution are essential to the philosophy of our program. We view the NDCF, including all of the apps, the resource materials, and the data visualizations, as continually improving. It starts with collecting data. Technicians use the NDCF at C-checks and see what works and what could be better. Then we gather feedback. We encourage feedback from every user. And you all can provide feedback by clicking on the report feedback link on the NDCF webpage. Then the NDCF team reviews every suggestion, and we do our best to develop an effective solution to address it. We implement those suggestions, then we continue with collecting more data, testing out those improvements, and gathering more feedback. And we will continue to solicit, gather, and review suggestions and improve the program. I like to review the way the data access is provided to various users, because I do believe this is unique to the NDCF program. The NDCF program employs a tiered access system. So currently, certified technicians who have created accounts have access to their own car seat check data. So as a technician, you can log in and you can see your data. Once approved, program managers have access to all of the car seat check data affiliated with their agency. And state CPS coordinators like Tracy have access to all of the data collected in their state. As I mentioned earlier, vehicle and car seat manufacturers also have access to seat checks conducted in their vehicles or using their seats. This data is critical to developing evidence-based solutions for improving CPS programs and saving more lives. For technicians, you will be able to track the number of car seat checks you are conducting, and you can start to understand the misuse you are seeing with the caregivers you are working with. The NDCF also eases reporting burdens as information from seat checks are entered and compiled as soon as the technician submits a digital check form. For agency and states, you'll be able to evaluate the same kinds of things, but at the agency or state level. You'll be able to easily extract how many checks are conducted, where, and also understand some of the trends and patterns that are occurring. Additionally, you can use the data to figure out which caregivers are attending and which are missing, so you can advertise to those geographic or demographic groups. So now a bit about what Westat does to process and analyze the data. While all raw data is maintained and available in the NDCF, data is also professionally cleaned, analyzed by our specially trained statisticians, and then presented in dashboards. So as with any data set, before data analysis occurs, we take several steps to clean the data. These steps create a data file that's ready for analysis in a statistical software package. We always maintain a raw version of the data that is always accessible to the users. That data never goes away and is never altered. So you can always log in and download your raw data. However, through the cleaning and preparation process, we create an additional clean data file. And this process simply enhances the data. Once the data are clean, we undertake the analysis. Just this past Tuesday, so hot off the presses, we released updated data and data dashboards. This release provides all of the NDCF data through January 2021. In total, we have now over 38,500 car seat checks. As we add in more and more data, we are beginning to see trends emerge. Most of the car seat checks are done for infants or unborn children, which is not surprising to anybody in the call, but a nice verification that we're getting good representation in our data set, right? And the most common type of car seat is the rear-facing only seats. As part of our analysis, we also examined misuse data. This slide depicts the percent misuse in 3 categories and also the top 3 types of misuse within those categories. Because remember, the NDCF will collect the data on whether something was misused and then how that specific thing, such as a harness, was misused. So we have a lot of detail here on misuse. So for seatbelt, when a seatbelt was used for installation, we can see the misuse rate was 61%. And then below that lists the top 3 types of misuse for seatbelt installs. And that was that the seatbelt was too loose, followed by the seatbelt was used in conjunction with lower anchors, and that the retractor was not locked. For lower anchor misuse, our rate was 43%, and harnesses were misused in about 38% of the applicable car seats. These are just some of the highlights. Next, I'm going to demonstrate how you can access these results and review the data on your own. Once the analysis is done, it's fed into data dashboards. These dashboards consolidate all of the results, and this is a bit like the Raven system that we were just talking about, right, with the maps and everything. So we consolidate everything into data dashboards, and these display the data as opposed to using standard tables filled with numbers and that are very tough to read. We try to do this so that we can highlight some of the few key findings, and these dashboards are built to display these findings in a more user-friendly format with the idea of making the data more useful to all users. They aim to make trends easier to identify and overall snapshots easier to understand. So users have access to a national level dashboard with all the checks from July 2018 through January 2021. So every user can see the national dashboard. Technicians that have personally conducted seat checks will also have access to a dashboard with just the car seat checks that they conducted. And finally, your state coordinator will have a dashboard with all of the checks that occurred in their state, or similarly for program directors, all the checks that took place in their program. From the NDCF website, that's carseatcheckform.org, there are 2 locations where you can access these dashboards. Agency or store coordinators can click on Agency Admin and then View Dashboard to view your agency dashboard. To view the seat checks you have conducted or submitted, click on My Account and then View Dashboard. And you can also view the national dashboard here as well. So this is the home page for the dashboards. You can see it provides summary information, including the total number of seats checked and the percent of misuse overall. This chart also shows the number of seats by month and by seat type. By graphing the monthly seat checks, we can see the dip in April and May of 2020 when the pandemic resulted in almost all of the country being shut down. Taking a closer look at the main menu, you can see from here you can access pages on misuse, maps depicting all of the seat checks by zip code, car seat information, and vehicle information. You can also access our brand new table tool, which I'm going to give you a little more detail on shortly. Throughout the dashboard, if you would like additional information about any data in a chart, you simply hover your mouse over the chart and additional details will pop up. In this case, you can see that 661 rear-facing only seats were checked in May of 2020. This dashboard contains many graphs and other visualizations, so I'm only going to go over the highlights today because we're limited on time, but I strongly encourage you, if you haven't already done so, sign up for an NDCF account and then take some time to review the dashboards. Here's part of the car seat misuse page. This map depicts misuse by the state. On this map, you can also see different types of misuse. So this map is currently depicting harness misuse among all types of car seat checks. However, you can click on different categories on the left-hand side of the page there, and you could toggle between all checks, postnatal checks, and prenatal checks. Then across the top, you can select misuse rates across the different categories, including harness misuse, load leg misuse, lower anchor misuse, and so on. So here's another example of the table tooltip. Of the tooltip. Here I've clicked on harness misuse, and then I clicked on the Maryland square because I knew there'd be some folks from Maryland out there today listening to me. And you can see the tooltip gives you the harness misuse rate. To provide context to this misuse rate, we also report on the total number of checks and the total number of checks used for this analysis. So you can see it's a pretty good sample size that we're working with. Finally, we provide the top 3 harness misuse subcategories in Maryland. So in this case, the harnesses were too loose, harnesses were in the wrong slot, and the crotch buckle slot or routing was wrong. For those of you that may have looked at this dashboard earlier, you may notice that we updated the formatting and the terminology in this pop-up, and that is thanks to Ms. Tracy Whitman from Maryland KISS, who gave us feedback on the way we had labeled all of these things. The car seat information page contains 3 different charts related specifically to car seats. I'm highlighting just one chart that depicts the number of car seat checks by the year the car seat was manufactured and whether the car seat was expired. Looking at this, we can quickly conclude that very few car seats were expired, with most of them being manufactured in 2019. Here's part of the vehicle information page. This provides summaries of the types of vehicles seen at car seat checks. This chart displays all of the makes, and when you hover the mouse over a make, the top 15 models pop up. When using this with your program data, it can help you understand the most frequently seen vehicles at your seat checks. You just saw these from Tracy, these forms from Tracy. As we were developing the dashboard, we considered other goals for effectively using the data. We received many requests for help in directly and simply providing all of the data needed for reporting. And I like to use these examples because Tracy was nice enough to share them with us to give context to what we mean by that. When we started talking to different technicians about the ways the data could help them, I think it was very hard for people to visualize how we could take the stuff that's entered into the NDCF and output it in a way that would help their programs. So as Tracy mentioned, this is their tally sheet where they simply tick off and count through all the forms, and that she's a little bit worried about error with that, and it's just time consuming and takes a lot of labor to go through. And then, as she also demonstrated, she takes those tallies, converts them into some additional calculations. So our ultimate goal is to eliminate the need for this manual counting and calculating, and instead provide these counts via the dashboard. So we try to figure out the best way to make that happen. Working with our programmer, we developed what we call the table tool. And the table tool allows users to select different variables or pieces of information that they would like to examine, and also apply some filtering. Short video provides an overview of how to work with the table tool, and we're going to cross our fingers and hope this works. All right, so he's just saying he's going to give us the table tool feature, a demonstration of the table tool feature, and we're going to access that from the dashboard main page by clicking on the table tool over on the far right. So here you can see all of the different variables or all the different pieces of information that you can look at. You can also see that we've got the total number of car seat checks here. So all not, whoop, sorry. Oh no. Oh. All right, so all we were seeing now was the total number of car seat checks. Then Alex is going to go ahead and pull one of these variables over into the center column. So you would just select and drag the variable you're interested in into the row position, which is that center column, and then up on that top right, that would be the column heading. So right now we've got child age, so you can see we've got a row for each of the different child ages, and we can have a total tally of how many, say, 1 to 2 year olds were at all of our car seat checks nationwide. And he just wanted you to note that that null down there means that it's just missing a value right there. We don't have a child's age for that record. And now we're adding any misuse. So now we have the total child age and misuse. And the other good thing about the table tool is that we could filter. So we're going to start over and we're going to look at this information for just a particular state. So we go over to the state variable, click the drop down arrow. If you select none, and then scroll down to the state you're interested in, which in this case is Colorado, and we hit apply. And this variable is now bolded, so you can note that it's filtered and it's been applied. And now we can see all of the car seat checks by child age and misuse, but now just filtered down to the state of Colorado. And those were just a couple examples, and we hope that you go and play with the table tool on the national dashboard to see what it can do for you. Getting the data into the hands of the CPS advocates like you is very critical to us. So in addition to the data visualizations provided in the dashboards, we also provide 2 different files to the typical NDCF user. As I mentioned, we have the raw file that's available in real time. That means as soon as the individual technician submits the form, the raw data file updates. And now technicians and agency leads and state coordinators can download cleaned data. And this file is accompanied by a data dictionary that explains all of the variables and should hopefully help you in working with the data. And that clean data file can be found on the dashboard. We are now also doing monthly updates. The clean data through January 2021 is now available. The clean data for February will be available the first week in March. And we're going to continue on that timeline. As always, raw data available in real time. We want you all to benefit from this resource, so we'd like to suggest some next steps. If you haven't already done so, please go ahead and register for an NDCF account. You can do that at carseatcheckform.org. and start using the form as you conduct car seat checks. And then the best way to understand all of the data that's available and to start to see the full story of what is happening at seat checks is to start reviewing the dashboard. Click around, try out some of the different options. Even if you don't have any seat checks yet, you can see the national dashboard and you can't break anything. So feel free to poke around, especially in the table tool. And then please be sure to give us your feedback by hitting that report feedback link on the carseatcheckform.org. So thank you. Please feel free to reach out to any of us on the NDCF program team, and we look forward to working with you.
Thank you, Adele. I hope everyone will try this if they haven't already. And I know for myself personally, while Cindy's switching the slides back, I love the fact that you can practice and you can't break anything. That's really a real bonus. All right,
I like that.
Switch over. We're going to have Jennifer speak now.
Sure, great. And I know we're running a little short on time, so I'm going to try to get through my slides as quickly as possible. My name is Jennifer Boak, and I coordinate field training for the National Digital Car Seat Check Form. And now that you've heard Adele speak about the NDCF data collection process and data analysis, I'd like to share some tips about collecting and documenting car seat inspection information using the NDCF. I'll also be discussing patterns of misuse and changes that have been made to address these errors. Next slide, please. Accurate data collection is essential to maintaining the integrity of the NDCF. And as you know, the data is only as good as the information that's being collected. So to help support this, the NDCF has added additional conditional fields as well as drop-down menus and skip patterns to improve data collection and reduce the amount of reporting errors. Adding these features provides the resource that is easy to use and understand while minimizing the risk of errors. Clean data will help drive improvements to CPS curriculums, educational messaging, funding, and program justification. Through the data analysis and cleaning process that Adele and her team perform, we learned quickly that many technicians are not taking the time to complete forms accurately. Misspellings, misuse of open text fields, and errors in documenting the correct seat on arrival are just a few examples. To support and encourage accurate and complete data collection, we have eliminated many of the open text fields and made most of the questions required. In doing so, we've significantly reduced the number of form errors, and instructors and program managers are encouraged to train all technicians, new and seasoned, on the proper way to complete a check form. While this may seem elementary to some, documenting the seat check is a key component to car seat inspection process, and the technician certification course does drive home the message to document, document, document. Next slide, please. Now I'm going to go over some general data collection tips and then show you some specific examples from the NDCF. So first and foremost, always carefully double check your work and carefully select the correct response options. Technicians are strongly encouraged to go back through the form and confirm that all the selections are accurate. Just like we wouldn't want you to rush when working with a caregiver, we don't want technicians rushing through completing the form. So please, again, make sure that your technicians are taking their time to accurately depict that inspection. If you catch an error after you've submitted the form, edits can be made by contacting us at info@carseatcheckform.org, but you should know that while we can make those changes for you, it will be documented in the NDCF program. We would make sure that we had a date and time stamp on that, and we documented any changes that were made to that form once it was submitted. Please only use the other response in a menu list as a last resort. The NDCF team has carefully considered all of the options for each question, and we've done our best to make sure we cover all common situations. The other field should never be used to record anything that doesn't pertain to the question being asked. In this example, we've seen many technicians select the other field and then type in car bed or medical seat. If you look at the list of response options, you can see that we provided specialized restraint to cover all of the car beds and medical seats. Technicians are encouraged to refer to the user guides to use the NDCF platforms, which will provide guidance on how to answer specific questions. Next slide, please. To help maintain the quality of the data being collected, all required fields must be answered. If there are any required fields left unanswered, the form cannot be submitted. All unanswered questions will be highlighted in red for easier identification, and it will bring you back as you move through the form. It'll take you right to that question that needs to be completed. Once all the questions have been answered, the form can be submitted and the user will receive a message indicating that the form has been saved. This feature supports consistency in information collected and helps provide making sure that we have accurate information when we've submitted that form. Next slide, please. We've also had some confusion over how to properly record children who have arrived restrained by a seatbelt only. For the purposes of the NDCF, if the child arrives restrained in a seatbelt only, then they do not arrive in a car seat or CS. Therefore, when we've asked for car seat information, the response option should be no CS. And the reason why this is important is because of the skip logic that has been built into the NDCF. In order to skip all of the car seat specific questions, the user must select no CS on question number 7. We've also had confusion about the car seat restraint type on arrival, which is captured in question number 8. You'll notice we don't provide 3-in-1s or combination seats as an option. This question focuses on the way that the car seat is installed. If it's a 3-in-1 car seat but installed forward facing and the car seat is the child is in a harness, then we would select forward facing with harness. It may be tempting to select in the other field and then type in 3-in-1, which we have had many technicians do, but this does not provide enough information about how the seat was being used. So remember to always document how the seat came to you, and the other field should only be used as a last resort. Next slide, please. The NDCF collects information about car seat and vehicle incompatibility. Initially, when this question was asked on the form, it simply asked if the car seat was incompatible with the vehicle. A resounding 38% indicated that the car seat was not compatible with the vehicle. This was alarming to say the least, and so we knew that we needed to restructure this question and provide the ability to expand on the issues that technicians were encountering in the field. We consulted with a group of car seat and vehicle manufacturers and asked them to provide feedback on how this question should be asked to ensure that we were receiving useful feedback. And based on that information we received, we added conditional fields, and now technicians have the ability to select incompatibility issues from the drop-down menu. Based on this and other questions on the NDCF, car seat and vehicle manufacturers are using the data collected about their product to research issues encountered in the field, which has the potential to impact design changes in both car seats and vehicles. Technicians using the NDCF are providing valuable feedback to manufacturers and are an important part of the data collection process as they report issues encountered in the field. Next slide, please. We received questions about how to answer specific questions on the form when the technician does not have all the information about the child, the vehicle, or the car seat. So we do strongly suggest that technicians consider screening the caregiver early before they come to the checkup event to gather details prior to the inspection. So gathering the child information, vehicle information, and car seat information ahead of time will help to ensure technicians have much of the required information needed to complete the form. Because the NDCF is designed to only collect car seat inspection data, only include information that is relevant to the seat check, and do not include any personally identifying information on the form in any of the open text fields. Any additional information that is not collected on the form that must be documented can be added to the documentation box, but we do strongly encourage technicians from not entering in any personally identifying information or any local level information. We request that they collect that on a separate document. Next slide, please. The NDCF is designed to be an effective tool for collecting seat check data and documenting use and misuse. Anytime the form is used in a way that it's not intended, we end up with a cascading effect of issues. Attempting to use the digital platform to collect information about seat distribution in which the caregiver arrives on a bus or maybe on foot, and there's no vehicle or car seat information collected on arrival, this creates issues when completing the form, which can ultimately affect the cleaning of the data. Because this is a resource developed by technicians for technicians, we receive a lot of excellent feedback and suggestions from the field, and we're currently exploring options to support the use of the NDCF for the purposes of documenting seat distribution as opposed to a seat check. Required fields like vehicle information cannot be collected if we attempt to answer question number 7 on arrival by selecting no CS. We are ultimately recording that the child was not restrained in a car seat in a vehicle. From a data perspective, this will skew the data, and collecting the seat check distribution data can still be documented by using the corresponding paper form. So that is something that we always have as a backup, is to encourage technicians to utilize the paper form to still be able to document as much information as possible if we're in a situation where maybe we have a distribution of a car seat or we don't have all of the vehicle information because they came in by foot or by bus or some other form of transportation. Situations like this are reviewed on an ongoing basis by the NDCF program, and possible solutions and updates to the form are made on an annual basis. And updates to the NDCF user guides are also addressed to help address these specific needs. Next slide, please. We encourage you to create an account if you haven't already at carseatcheckform.org. It does take about 1 to 3 business days to have your account activated. You do need to upload a current copy of your certification card by going to cert.safekids.org. Next slide, please. We also encourage new users to practice using the NDCF. We do provide you with the option to use the training option in the state's drop-down menu, and by using the training field, any of the information that you enter in that you're practicing with will not be uploaded into your state's data. If you inadvertently select your state and enter in and submit a practice form, you can simply just email us and we will remove that from your state's data. But we do provide you with the option to be able to practice before you start working one-on-one with a caregiver. Next slide, please. We have a wealth of resources available to you on the National National Child Passenger Safety Board website. We have a special page designated to the NDCF where you can find tutorial videos, how-to guides, and FAQs. Next slide, please. And as Adele pointed out earlier, here is our contact information. If you have any questions or you want to schedule a training or a webinar, or if you're having any issues using the NDCF, we are happy to help. And I'll turn it back over to you, Suzanne.
Thank you so much, Jennifer. I know we're pretty much out of time, and we did have an ambitious agenda. There are some handouts through GoToWebinar, including all the speakers and how you can contact them and find their resources. And just quick note about the CEUs, you will get an email tomorrow if you are at CPST that will have your verification that you participate in this webinar. If you're at Maryland EMS and want to get credit for this, you need to send me an email at cps@mims.org with your provider number, and then you can get credit. And if we're not going to get cut off by GoToWebinar, then let's do some questions. But thank you to all the speakers. We had an ambitious agenda, and you did beautifully, and I hope it was helpful for all the listeners.
One of the questions is, does the NDCF dashboard data, is that data available by state?
Yes, particularly if you are the state coordinator. When you open your dashboard under the agency admin view, you would only see checks for your state. Does that make sense? So you need to be the recognized state coordinator.
And I guess the question is, every state has a recognized coordinator. Would that information also be available to state highway administrations across the country?
This is Jennifer. All of the NHTSA regional offices have access to the data as well. So they would have access to the state's data.
And if I am a child passenger safety technician entering data, would I have information just to my personal forms that I entered? Or the forms that
is correct.
Yes, so yes. That's a great question. You will have access, technicians have access to all of their data. If their name, we do provide with the option of adding additional techs participating with a seat check. And so if you've logged into your account and you have an additional technician helping you with that caregiver, they would also have access to that information in the form of a CSV file, which is immediate. As soon as it's uploaded into the system, the technician would have access to that data.
Okay, great. There's another question about data, and it did come very quickly at the same time, so I think it's about the same data set. What do you mean by cleaning data when it's prepared for analysis?
Okay, yes, I'm sorry. I usually do have a few more slides on this, but given the time limit, I needed to cut some slides. So data cleaning, there's a lot of standard things that happen with any kind of data set. For example, when people do use those other fields, as Jennifer pointed out, we had a lot of people that said card beds and everything. So we have to manually go in and say, oh, card bed, that's a specialized restraint. So let me fix that. That's really what the response option should have been. Let me correct that. Throughout all of this work that we do with the NDCF, we always err on trusting the technician. So there are times where we're like, wow, so the kid was 50 pounds and they were in a rear facing only car seat and that seemed okay. We leave that as is because that's that's what the technician is reporting. There are other things. Previously, you used to be able to type in the vehicle make. So the example I usually provide is when we went to run that on the year one data, we got about 400 different ways of typing Chevy or Chevrolet, right? Misspellings, shortens. Yes, that's why it became a drop down, because then we just had to recode that, because if Chevrolet wanted to pull all of their car seat checks, if there were misspellings and things like that, it wouldn't pop up. So that's what we mean by cleaning, but that is also because we know people can be very concerned about their data getting changed or manipulated or anything. There's always a raw data set. We don't touch that at all, and that's always available to technicians, but then we do the cleaning. We also, collapse down some variables, derive some variables, that kind of thing, just to help populate our dashboards.
Great. I do not have any other typed questions. I will at this time, and I should have done that when I started, I will open the phones for all attendees to be able to speak. So at this time, anyone who is still on the webinar has local control of their microphone. If you want to raise your hand and unmute yourself, I'd be happy to call on anyone.
Any comments about using the databases together, or comparing data? I think hopefully you got out of listening to all of these that any one data set might not, or method might not, give you everything you need, but using a variety can be very helpful.
So, Suzanne, this is Tracy. I did want to point out something with the National Digital Check Form apps. If they have not updated since they made the changes with the drop-down menus, if you're using it on an electronic device, a tablet or a phone, you'll want to uninstall and reinstall those apps to gain access to that, to the drop down, to the updated prompts.
That sounds like a good thing to know. Thank you,
Yeah.
Tracy.
Thank you,
Thank you.
Tracy. I should also add that we plan on doing another update that should launch around October. We try to do it annually. And so as we receive feedback from the field, it goes into a repository where the NDCF program team reviews every request, every piece of information that we receive from technicians in the field. And with that information, that's how we work through some of the changes and really trying to make this work for as many programs and as many technicians as possible. So as Adele had mentioned earlier, we really do want to hear from you. We want to help build and evolve this resource so that it works for all technicians.
Are there any final comments?
Yeah, this is Glenn with the Washington College GIS program. I just wanted to touch on a little bit of additional information from what Sean presented on. So he had mentioned that there's additional resources, downloadable products. One of those is a statewide zip code tabulation area map that shows the density of occupant protection related crashes and stops from citation data. It looks at it as a whole rather than as a under age 12 or a child aged resource, but it might be a starting point. The Raven application is meant to be a starting point for general information. We do also do quite a bit of custom analysis, and by that, based on what your needs might be, we can work with you to identify whether it's the citations, whether it's crashes, or a combination of both to find locations that have high instances of those. One of the things that we happened upon last year for the Bay to Beach campaign was a charge code specifically for children under the age of 8 unrestrained in a vehicle. And what we found was 11% of all unrestrained occupants were under the age of 8. So out of all of those, there was one vehicle that had three citations issued to that single vehicle. And Mark and I have discussed it. We've worked a lot with occupant protection, with Highway Safety Office, and it's somewhat alarming. But we can go into all of these different data sets. The only thing that I will say we do request is a 15 business day turnaround. And if it involves point data, location data, SHA from our memorandum of use, SHA requires 3 days to approve the point locations. But if there's anything that we can help out with, by all means, feel free to reach out to myself and Sean, and we'll work with you to get your products done.
Thank you, Glenn. Any final comments or questions? Great. Well, everyone stay safe and have a good rest of the day and rest of the week. And this will be archived so you can check back if you want to see it or refer someone else to it. But thank you again.